Friday, December 7th, and must be time for another legislative update from your North Carolina Medical Society because it's week 2 of another session.
Yeah, that's right. So we've been down at the building, but most of what the legislature has been focusing on is voter ID. So the voter ID bill passed and has been sent to the governor. So we're in our waiting space to see what the governor will do with that bill.
Yep.
Some other bills have had some movement, some local bills, some bills on hurricane relief funding, that we mentioned last week.
Right.
So that's really been what's been moving forward.
And all that has been in the newspapers you've probably seen or on the TV. But what has been going on behind the scenes has been a rich discussion about what's happening in the state health plan. And you're all aware, because of the letters that they've been receiving, about the new reference-based pricing that the Treasurer has proposed to start in 2020, January of 2020. A couple of legislators, Representative Dobson, Dr. Murphy, and Representative Lambeth, have all gotten together and really expressed concern about this reference-based pricing and the impact that it's going to have. We recognize that on physicians, some are going to go way up, some are going to be impacted really negatively. On the hospitals, there's more of a uniform negative impact. And so the legislators have been looking at their communities and realizing the impact going on in their communities and have wanted to really kind of just hit the pause button, think about this, have a couple of meetings so that everybody can understand this in a public, transparent way. But there's been some concerns.
Right.
Right?
We've heard from some legislators that they need more information and are kind of hesitant on being back involved with the state health plan, considering that they gave this power and authority over to the Treasurer 8 years ago. Yeah.
And it's one of those things where the legislature kind of gives up something because they're tired of making those decisions. They want somebody else to make those decisions, and so it's kind of difficult for them to get back into that, right, to take that back on. But it's still something that's important that we think for you to be talking to your legislators about this. Whether they're going to do something about it in this legislative session or not, probably unlikely, right? Probably. But that's not to say it's definitive. We're still going to be here at least through Wednesday of next week or more next week.
Christmas.
Let's hopefully not through Christmas. But it's important that you talk to your legislators about this for now or for in the future. I mean, this is something that's going to be going on for a while. The changes don't take effect until 2020. There's still a lot of other things that need to be flushed out, not just with price, but one thing that we've been talking with the Treasurer about is how are we actually improving health? What are we doing to make sure that the state employees have the necessary tools, support, counselors, navigators, whatever, to make good health choices for themselves, not just about price, but about their daily living, the things that are most impactful on their health. And so none of that has really been flushed out yet as well. All we've really talked about is the new fee schedule. So a lot more to come on this. Keep talking to your elected officials because this is a major program that is funded by the General Assembly, even though it is managed by the Treasurer's office through the state health plan. It's important that you talk to them. So keep that up, and until next week, we'll talk to you again. Have a good one.